Andrea, let's start with you and the RFK Jr. nomination. What was your initial reaction?
I gotta say, alarm. As a biomedical scientist specializing in immunology and microbiology, I've been well aware of his rhetoric for years. And his nomination as Secretary of HHS, it amplifies someone who's spread just misinformation on basic science principles, immunology, vaccines, infectious diseases, cancer, and overall public health. And so there's a lot that he could do in that role because that agency oversees other critical federal agencies like the CDC, the NIH, and the FDA. And so he could actively undermine these critical agencies and the work they do with scientific research, funding initiatives, public health outreach, and more from the inside out. And so it's really important that we have a leader within that organization that actually champions evidence-based science and not someone that plays in conspiracy theories.
Okay, and now we still have to see whether these picks will be confirmed, but Tim, what is your most pressing concern about RFK?
Yeah, I agree with Andrea. I was absolutely horrified. It seemed surreal. As someone who's studied this area for a really long time, I thought it was absolutely surreal to see him appointed or, potentially appointed to this position. One of my greatest fears, it maps on to something Andrea said, is just the normalization of misinformation, right? Just the normalization of conspiracy theories and this anti-science ethos is going to do grave, grave harm. And to be honest with you, it's already started. We're seeing this sane washing of RFK and Dr. Oz. He's just a vaccine skeptic. He has a controversial position on vaccines. No. He is a hardcore anti-vaxxer who spreads harmful lies that have done great damage, not just in the United States, but really around the world.
Tim, Canadian health authorities, as you know, often follow the lead of the U.S. vaccine approvals, for example. If that research slows south of the border, how could it have an impact on us here?
It'll have a real impact, and just the scientific perspective, right? I actually am involved in several big research projects right now with vaccines, and we have partners in the United States, and you can bet they're already concerned. But also think about it in the context of vaccination hesitancy. Right now, I think there's 130 measles cases Is it over 130 measles cases in Canada? Right now, vaccination hesitancy is increasing in Canada for COVID vaccines, flu vaccines, HPV, and yes, measles. Look, I think it's important to emphasize just how valuable vaccines are. And this is just one of the areas that RFK Jr. has spread misinformation. Recently, The Lancet published a study that suggested that vaccines have saved 150 million lives in the last 50 years. And despite that, we're seeing the increase in hesitancy. Look at this data point. In the United States, about 30% of people are open to or believe the lie that vaccines cause autism. And I'll tell you, RFK Jr., he gets a lot of blame for that.
And Tim, we have recently heard health authorities say that the numbers could be better in Canada for the uptake of the COVID vaccine, the flu vaccine as we head into winter. Andrea, RFK has said a lot of questionable things about vaccines, as we mentioned, about what causes AIDS, the supposed dangers of fluoride in drinking water. But he has also spoken out about the health impact of ultra-processed foods in the U.S. So what do you make of that?
So this is, I think, the thing that is most frustrating because, a lot of the sane washing is like, well, he's really anti-vaccine and he, says that HIV does not cause AIDS, but he's got some good ideas about healthy food. And the reality is that this is not true. He misses the bigger picture, and he also ignores his contribution to this. RFK Jr. himself has demonized more affordable, perfectly safe, conventionally grown produce for decades. His messaging has spread harmful lies about pesticides used in conventional farming. They ignore the fact that organic farming uses lots of pesticides, many in higher quantities, many of which are not safer, and that the residues that you're finding on these finished food products are not anything that's going to cause harm. What will cause harm is scaring people away from more affordable fruits and vegetables. And we have data that demonstrate that lower income people who are exposed to these false claims about the harms of pesticides end up buying and eating fewer fruits and vegetables.
Andrea, just briefly want to touch on Dr. Oz. He has been called out for making baseless medical claims. He championed an anti-malarial drug as a COVID-19 treatment. What is your biggest concern with him?
So the biggest concern with Mehmet Oz here is the fact that he has made a multi-million-dollar career out of exploiting vulnerable people, making false health claims and selling them false promises about ways that they can take control and hack their health. And my concern is what's going to happen if he is then allowed to lead the Centers for Medicare and Medicaid Services. So his track record of taking advantage of people for personal benefit and putting his own profits over public health, especially when those claims have no scientific evidence, is really concerning because CMS is overseeing Medicare and Medicaid, which provides healthcare and access for millions of Americans, most of which are the most vulnerable, the elderly, low-income individuals, and people with chronic and complex medical issues. And so I fear that he's going to take the same tactics he's made millions of dollars on over the years and utilize that to undermine evidence-based healthcare, evidence-based health interventions, and loosen the regulations on pseudoscience and have a willingness to prioritize sensationalism and alarmist claims over true factual information.
Okay, Tim, a last word from you. If both of these picks are confirmed, a science skeptic and a person who has advocated for pseudoscience, how could that affect how people view their medical science here in Canada?
Oh, dark days ahead. Look, in addition to the whole normalization of pseudoscience process that I talked about earlier, I'm really worried that all of these topics, whether you're talking about fluoride or raw milk or vaccines, they're going to become increasingly politicized here in Canada too. And once this becomes about politics and political identity, it becomes very difficult to change people's minds. We cannot let sane washing win. We cannot let the normalization of anti-science win. We need that candle in the dark, you guys. We can't let it get extinguished.
Well, on that note, Andrea Love and Tim Caulfield, thanks for joining us.
Thanks
Thank
for
you.
having us.